So my name is Bernard Jaar. I'm a nephrologist, part-time faculty at Hopkins and also in private practice in Baltimore. I work also with the National Kidney Foundation Education Committee, and our goal is to try to educate nephrologists, but also primary care physicians about chronic kidney disease particularly. One of the ideas that we had was to organize once a year with the National Kidney Foundation Spring Clinical Meeting a symposium for primary care physicians as the Spring Clinical Meeting moved from city to city. We would organize a local symposium for primary care physicians of that area. That started last year with the Spring Clinical Meeting in Washington, D.C., and this year we have the opportunity to create the same symposium here in Orlando. One of the topics of interest is to educate primary care physicians about new development in the field of chronic kidney disease, make them understand the burden of chronic kidney disease in terms of the epidemiology, particularly the prevalence of kidney disease in the communities in the United States. Also the consequences of chronic kidney disease, as chronic kidney disease is associated with a very high morbidity and mortality rate. One other idea that we have is to help the primary care physicians implement some action plans for their patients who have chronic kidney disease. Those action plans were developed by the National Kidney Foundation. We'll also discuss with them ways of communicating with nephrologists. So the relationship between primary care physicians and nephrologists is also a topic of interest and also very important. The idea is to develop a co-management system between primary care physician and nephrologists, the respective roles, and also when to refer to nephrology. And then finally, one aspect of the symposium also is to touch on renal replacement therapy options for the patients. Hemodialysis, home hemodialysis, peritoneal dialysis, kidney transplantation, even preemptive kidney transplantation will also be discussed during this symposium.
Hi, my name is Mike Choi. I am the Clinical Director of Nephrology at Johns Hopkins. I was formerly the Program Director, and I serve as the Vice Chair of Education for the FNKF KDOKI Committee. And we're very proud to be able to have this conference between nephrologists and primary caregivers. And we thought this was very important from the nephrology community because oftentimes we're getting these patients too early. So what we were hoping to do was to review with our primary care physician partners our new staging guidelines, where it's not just 1, 2, 3, 4, 5. Everybody at 4 is going to go to 5 faster than anybody at 2 to 3. We all know that's not true. Now with the staging guidelines, we know, hey, if you have a lot more proteinuria, even if you're in that early stage, that's the time where we should be seeing patients to see if we can slow down this progression and hopefully stop it. The other things that we were presenting were going to be things like, what could we do, again, when we're preparing patients for renal replacement therapy? What can we do to preserve access? So things like avoiding PICC lines in patients who have severe chronic kidney disease. What medications can we monitor? What medications should we really be looking at? Again, more detail about some of the guidelines for referral. And I think for those reasons, we thought it was very important to have this conference with primary caregivers, and we're hoping to do this every year at each National Kidney Foundation meeting. And again, I'm just very proud that the National Kidney Foundation is allowing us to present this, and I think that hopefully we'll serve a great purpose by doing this.